My name is Esarrah Hopkins. I'm a community health educator for Tennessee's Community Engaged Alliance Against COVID-19, also known as Tennessee CEAL. Today I'm presenting our research on addressing COVID-19 vaccine inequities among the medically underserved minority population in Tennessee. Our research pertains to the 1,482 COVID-19 related surveys administered by our staff, community health educators, and health workers. During the reporting period, we used paper surveys, which were administered to underserved communities at various vaccination events, which took place at churches, cultural gatherings, community events, living assisted facilities, festivals, and more. Data from our surveys was monitored and analyzed by biostatisticians, and Tennessee CEAL worked with Meharry Medical College's Mobile Vaccination Unit, the Tennessee Department of Health, and vaccine strike teams from Vanderbilt to facilitate vaccinations. To address the COVID-19 inequities seen among the medically underserved and understand why hesitancy is a problem, it's important to know exactly who we're serving in these communities to better gear our efforts toward these groups. Data from our surveys in this reporting period shows that of all participants, 72% identified as women, 38% earned degrees, and 86% were predominantly English speakers. In addition, we examined possible barriers such as employment and insurance and found that 50% were employed and 74% have some sort of health insurance. Knowing these things help us to implement specific outreach to these demographics with specific information, whether it's to pregnant women, Spanish speakers, or providing resources to certain job sites. Participants also answered how much they trust the COVID-19 vaccine and who they trust to give them information about it the most. This is important because it helped us to understand how to best reach medically underserved populations and where to implement our education. Approximately 67% of survey participants are very confident and somewhat confident that the vaccine is safe. On the other hand, about 15% of those participants are made up of those who, 1, do not trust that the vaccine is safe, 2, have concerns about the side effects, or 3, just don't like needles. All of these factors translate into a notable number of individuals not getting vaccinated in these communities, and our research shows that participants' greatest level of trust to learn COVID-19 vaccination information from lies within their healthcare providers. On the contrary, 65% of participants showed little to no trust in social media as a source of information. How can this information help those addressing barriers? Well, we work to build a social media presence that is trustworthy and continuously provide up-to-date and correct information and education directed to the communities that need it most. When taking a look at our participants' COVID-19 testing history, we found that 79% of participants tested for COVID-19, and many of them, 77%, tested more than once. Of those who did get tested, 23 got positive results back, and it provides us with a measure of how great the burden of COVID-19 diagnoses are in these communities. There is significant vaccine hesitancy and barriers in Tennessee. We strive to increase vaccine uptake among medically underserved populations in Tennessee with 1, ongoing surveillance to ensure awareness, 2, education, and 3, continual access for the medically underserved. Understanding the barriers to vaccine uptake and miseducation can help address the systemic issues that contribute to the COVID-19 inequities seen in minority populations. It's a reminder to strive to connect with community organizations and vaccine partners so that we are able to break barriers and provide individuals with education to dispel myths and miseducation that lead to vaccine hesitancy. Thank you for your time.